little movie trivia to start this out. 2004, American Film Institute was doing a ranking. And what did they rank #1 when they were trying to figure out the 100 greatest songs in American films?
The one from Rocky?
Got any idea?
I think it's probably going to be something Disney.
Meet Me in St. Louis, Judy Garland. Have Yourself a
No,
Very
but
Merry
Julie
Christmas.
Garland is...
Somewhere Over the Rainbow.
Yes, absolutely. Good job. Somewhere Over the Rainbow. #1 song as in 2004. Now, therefore, which movie did the Library of Congress name as the most watched film in history in 2004?
Gone with the Wind?
Gone with the Wind or hits.
Wizard of Oz.
The Wizard of Oz. There you go. 1939 film, and I find that fascinating because a lot of people who loved that film and rated it as #1 in the survey weren't even born in 1939. Okay, in The Wizard of Oz, how many of you seen it? Yeah, pretty good. Each character had a complaint, or a lament as they called it. And something that wasn't working for them or that they wanted or so on and so forth. So what was Scarecrow's lament?
The brain.
Yes, good. If I only had a brain. Well, technically, metaphorically, he had a brain. He just didn't know it. He wasn't aware of it. He was not using it. He was just saying, if only I had a brain, life would be better for me. Well, he had one. When he finally realized he had a brain, and you remember where that was in the sequence of the movie, you remember what he said. Read it out loud with me. The sum of the square roots of any two sides of an isosceles triangle is equal to the square root of the remaining side. Okay, you have to have a brain to know what that says. And when he said that, do you remember his line? Oh, joy, rapture, I've got a brain. Okay, well, we each have a brain in this room. And as I go around... Pardon? You're not going there. There's always one in every crowd. But the point is, when you say something like that, you have to have a brain in order to come up with that. I find that the brain is a mystery organ for most people. It truly is a mystery organ. They don't know anything about it. They know they've got it. They think it's somewhere up here, but they do not know how to use it by design. And that's what the science of brain function is all about. It's a very recent science. We could only really have a science of brain function once we got brain imaging equipment. Because before that, there were only a couple of ways that we learned anything about the brain. One of them was, after the person had died, we'd crack their skull open like you crack a hard-boiled egg. And you would take their brain out and slice it on a meat slicer, literal old-fashioned meat slicer. Lay all the pieces out on a light table and look at it. And we learned some things about the brain doing that, about structure. We learned that brain, something must have been going on with that brain because there's some holes here that aren't usually in a brain. But it did nothing for the person whose brain was on the light table, #1. And it didn't teach us anything about function. And then, or the other way was we'd watch behaviors. I mean, that's what Hippocrates and Galen did way back, long before any of us were even thought of. And observing behaviors in large sample groups of people, you could come up with some ideas of maybe what's going on in the brain. They didn't get it right. Hippocrates said, there's differences in behaviors because there's 4 different kinds of fluids in the brain. And depending on how much of one kind of fluid or another you have, you will exhibit different characteristics. Okay, he had the fact right that there were 4 chunks of tissue and that different brains did exhibit different characteristics, but not because of fluids in the brain. But he named those 4 types. Some of you will remember those. What did he name them?
Phlegmatic?
Phlegmatic,
Sanguine?
sanguine, melancholy, and choleric, or choleric, however you want to pronounce it. So when you think of my face as a clock, 12, 6, 9, 3, draw 2 lines, there's those 4 chunks of tissue. And in the research studies that we've done so far, if people scored high on a temperament analysis with choleric, that was aligned with the left frontal lobe. If they scored high as sanguine, that was aligned with the right frontal lobe. If they scored high as melancholy, that was equated with this right posterior part of the brain, and phlegmatic with the left posterior part of the brain. So back in 5th century BC, 2nd century BC, certainly AD 200, researchers were definitely already coming up with observations that have turned out to be quite accurate now that we have brain imaging equipment, even though what they thought it meant wasn't necessarily accurate. So, you have a brain, and it is unique on this planet. There will never be another brain like yours. There has never been another brain like yours. It is as different as your thumbprint. The problem is that we only know our own brains, and some of us don't know that very well. And we know how our brain responds, and so we think every brain ought to respond like ours, and if it doesn't, what do we tend to think?
They don't believe us.
Something wrong with that brain, because there's certainly nothing wrong with me. And with that perspective in mind, that's where we get a whole lot of problems in life. You know, I look at this as saying, sign above the dotted line. You look at that as saying, nobody signed above the dotted line. And the tendency is to go, what's wrong with you? It's pretty obvious that that's a direction. And you go, no, it's not necessarily a direction, it's what exists. There's nothing above the dotted line. Nobody signed there. And couples and friends and children and parents will argue for 11 weeks about something that simple, metaphorically, because all you know is your own brain. So, since all we know is our own brain, it's pretty safe to say that each brain only has its own opinion. Yes, I study the opinions of other brain function researchers, and sometimes I change my opinion based on what I've learned, and sometimes I don't. But the bottom line is that's all I have. And people talk about hard science and soft science, and I laugh. Every research project in the world has been crafted by, done by, and analyzed by a brain. So every research project on this planet is skewed to the brains of the individuals who did it. And every way we understand it will be skewed by our own brains. It's not good or bad, right or wrong. It is what it is. So I often preface things that I say by what my brain's opinion is. Because you might have a different opinion, and you can talk to almost anybody on this planet about almost any topic if you speak enough of the same language to communicate, and you'll have a slightly different opinion. So when somebody says, yeah, I agree with you, that's my opinion, well, they really don't know what each other's opinion is. But based on what we said, they have some gist of it and say, yeah, that sort of fits into my constructs. So if you get this, you just had your last argument, period. Because when people argue, the research suggests that one of those brains, and probably both, really think it knows. And if it talks louder and longer, and throws in some coercion, some pejoratives, maybe that blank, blank other brain will finally get it and tell me I'm right. And it is a waste of energy. So, as of today, stop it. I cannot remember the last time I argued about anything. I'll give somebody my brain's opinion, and if I have time to exchange and listen to theirs, it might be different, and that's great. And if it is different, I'm not going to argue about it. It's their brain. It's got nothing to do with me. And I do know how to negotiate if a group of brains have to come down to one solution. But I know when that happens that it won't work for anybody. Because it will not be a solution that works for every brain. It will be a collective compromise. And that's okay. So what are the takeaways? Because that's the piece of brain function research. But until you apply it, it's just a fact. So the application is, number one, stop expecting another brain to ever understand yours. Period. You don't even understand yours. If you did, you would be consistently successful. Because all of the secrets of success are built into the brain. If you understand that and start using your brain by design, you can increase your risk for being successful. And as I mentioned, stop with the arguing. It suppresses immune system function. That means you're going to be less healthy. It alters neurotransmitters in the brain. It can cause your brain to downshift. And we'll talk about that briefly. So it's pretty lethal. I'm not going to ask when you had your last argument. I did that once. A man said, well, I'm about to have my last one with you. And I said, well, good luck trying, because I choose to avoid arguing, so it's going to be a one-sided thing here. So the more you understand about brain function, the more tolerant you can be of how different brains are on this planet. And we're talking about brains, quotes, that are normal. Normal just means commonly occurring. And so in our culture, we have the bell curve of distribution. And the research applies to people under the bell curve, which is about 2/3 of the population. And those are the people, quotes, who are normal. Any brain that doesn't fall under that bell curve is considered abnormal. That doesn't mean there's anything wrong with it. It means that it is a little more different, perhaps, than some of the rest of our brains. So if you get that, we can start teaching our children to be less critical, to stop putting people down when they are a little more different. Because every brain is different. Every brain is damaged. It's just that some shows more than others. You know, a brain that is damaged and cannot control, for example, muscle movement, and so the body and the facial muscles are jerking around, that's a little bit more obvious, because the normal brain, we all jerk from time to time, but we don't do it consistently. That's a little bit more obvious. But then look at dyslexia. You know, I've been dyslexic since I was born. It's not as obvious. So every brain has its challenges and its strengths. And we need to stop assigning this little box of normal to the brain, because it's not going to happen. So I mentioned your brain's about the size of your 2 fists. And it looks very much like a walnut that's been cracked out of the shell whole. 2 halves, and then it's got those little bridges in the middle. You know, when you hold a walnut up to the light, you can see that space and the connections. Well, there are 3 or 4 bridges that connect these 2 hemispheres so that they can talk to each other. You know, there's a tiny, minuscule percentage of people who don't have a corpus callosum, and brain was born without it. And those people can think just fine, but they can't readily exchange information between the 2 hemispheres. And they'll have difficulty crossing the midline of the body, for example. they'll have difficulty. You say, put your right hand on your left shoulder, and they come up to the midline, and they can't get any farther because the highway doesn't allow them to continue across the midline and touch their shoulder. This largest connector, the corpus callosum, is not done, it's not wrapped with insulation until about age 20 or 21. And that's important to understand, because those of us who theoretically have got this highway paved, wrapped with insulation, and we're dealing with individuals who don't, until that process is done, any brain under the age of about 21, sometimes 22, sometimes they're a little faster developing, 19, they can short out at any time because the insulation isn't completed. So we look at bodies that look like they're done, and we forget that their brain may not be.
It says insulin up here, but you are referring to insulation?
Must be coated, yes, that's right. This is how I get my slides proof. Good job. Coated with insulation called myelin.
Could that explain why we have trouble with teenagers?
You're gonna have trouble with teenagers for all kinds of reasons. Some adult brains think they really know. Some adult brains forget that this process isn't done. So keep looking at these slides because they're new. And this is how I get my slides proofed. You cannot proof your own work, you do know that.
Yeah.
This is a proofer, so you're in
Good.
trouble.
Ran it through spell check, and it's spelled right. It's just the wrong word. Now, there's another way to look at that. Myelin can be thought of as the brain's asphalt. And so you can also think of these highways as needing to be paved with blacktop. And that's what this process helps to accomplish. And you know, if you're driving on a partially paved road, you're going to hit gravel spots, you're going to hit potholes. Sometimes you hit that anyway with paved roads. But that's another good metaphor for understanding that until this process is done, that brain is going to hit a pothole periodically. And a brain that's done is going to look at that brain and go, what were they thinking? Well, they weren't thinking in the sense of how a more developed brain would think. And we have inappropriate expectations often for individuals whose brains aren't done. And the other thing is a lot of people made impactful life decisions, you know, married, 4 kids, 3 dogs, what they thought they were going to do for a career the rest of their lives before their brain was even close to being done. One of my best girlfriends got married at the age of 15, and by the time she was 19, she had 3 children.
Oh.
Her brain wasn't even insulated or paved. So she wakes up at 25 or 27 one morning and looks around the house and calls me and says, Arlene, what are all these people doing in my house? I says, I don't know. Have you been invaded? Who's in your house? She said, a man that says he's married to me and 3 kids and 3 dogs, and if I was making the choice now, none of them would be here. Doesn't mean I don't love them, but I would not make those choices now that I made back then before my brain was done. So one of the things I'm constantly encouraging young people to do is slow down. Because who you think you want to wake up next to for the rest of your life when you're 19 can be light years different from who you want to wake up to next to you for the next lifetime when you're 29.
That could explain our high divorce rate.
I think in part it does explain a high divorce rate. Higher, with, what is it, 54% now? A lot of people married before their brains were done. But that also, I believe, goes along with not understanding brain function and expecting another brain to be like ours. And when it isn't, we think there's something wrong with them and we get upset. If every brain was like mine, it would be so boring on this planet. It's the differences. How would you like to eat the same food 3 times a day for your whole life?
Not even the whole day.
I need variety. And some brains need more than others. So it's the variety that keeps us interested. It's the variety that keeps us eating and loving the taste of the food. And it's the variety in brains that we sharpen each other on our brains. Think of it in that way, because not every brain thinks the same thing, and I'm always delighted when somebody says, oh, but have you ever thought of this? And I go, no, I haven't. I like that idea. I'll think about that. And it wouldn't happen. All right, a little bit about neurons. Neurons, you know, are the cells. You have what you were born with, and pretty much in terms of neurons. They talk to each other. They're the type of cells that communicate with each other very regularly. And the neurons in your brain form the basis for IQ. This is a drawing of a neuron. And by the way, I forgot to say, if at any time you feel like you want to get up and move around, please do so. The research is that 50% of brains learn best when they're standing and or moving. So if this is a bell curve, half of you would be listening better if you were standing up. So get up and move anytime you want to. Somebody said to me the other day, well, won't that disturb you? And I go, no, I'm not visual. Unless you make a lot of noise, I won't even notice. So, neurons are arranged in fields, according to Dr. Chilton Pierce, of about 1 million neurons per field. Lots of fields in your brain, and they vibrate. Each neuron in a field vibrates at the same frequency. They send and receive at that frequency, which means when you meet somebody and you instantly feel comfortable with them, it may not mean that it would be a good idea for you to bring them home with you. All it means is that your brains have recognized some commonality of frequencies. That can be a nice foundation on which to develop a relationship, because you know that you've got some similarities. For some reason, my brain is not telling my voice to stay clear. So that's all it means when you meet somebody that you feel comfortable with. And that's all it means when you meet somebody that you don't feel comfortable with. Your brains aren't recognizing any commonality. Some male-female differences here. Females have a little more trouble statistically working with people they don't like. They think they have to like everybody. No, you don't. You just have to work with them. Men do better at that. You know they just have to work with them. They don't have to take them home with them after work. And that's one of the things that women need to get. I was asked to consult at a corporation not long ago where there was a department primarily of females, orchestrated, managed by a male. I'm going to talk about stressors in the male brain in a bit. And he hired a woman, and half of the women in the department didn't like her. So they started coming to him and whining. And you know what whining is. Anger. Squeezing out through a very small opening. And they were whining about they couldn't work because they didn't like her. And his response was the typical cut and dried male response. Well, get over it. You just have to work with her. And that's true. And it's because every brain is different. So you may dislike somebody because there's none of this commonality, but it doesn't mean you can't work with them. The other thing is that sometimes people, when you meet them and there's no instant connection, and that's happened to me in places where I have worked, once you get to know them and start recognizing their strengths, which sometimes complement things that are hard for you to do, you can collaborate with them very well. You may never want them to be your best friend, but that's not what work is about. Work is about accomplishing things, and we need lots of different brains to do that. So I mentioned normal. characteristics under the bell curve that this culture, this society says are commonly occurring, and therefore that's what is normal. Please understand that normal does not mean healthy, functional, or desirable. It just means commonly occurring. There's lots of commonly occurring behaviors in this society that are not healthy or desirable. Smoking is one of them. Nobody thinks anything pretty much about seeing somebody inhaling a drug right there in public, doing their addiction, because it's commonly occurring. Nobody thinks about drinking 3 to 10 cups of coffee a day, commonly occurring. So it doesn't mean it's healthy or desirable, it just means it's commonly occurring, and society has agreed that that's okay. Well, I'm not normal. I don't smoke, and I don't drink 10 cups of coffee a day. I take Delta E, that's my caffeine, denatured caffeine for the day. So remember that every brain is damaged. If you get that, then brains that are different from yours, maybe very different, are no threat. Because yours is damaged too. You just might not have figured out exactly how it was damaged. You know, as I get older, I'm learning how my brain's damaged, and it's fine. I'll live with my damage. And we also have some areas of giftedness, even brains that are called savants. Their areas of giftedness are just absolutely off the chart, and none of the rest of us can do it. There's lots of things they can't do, but there are many things they can do that the rest of us could not do. So a little bit of old news, because you've probably heard this. The research came out last fall. There's been so much hype for so many generations about what some of these labels mean and what the parents did or didn't do to cause it. And the good thing about some research is that you can stop that. So, for example, multiple studies, and you can go to my website and you can look up brain references and you can find lots of this information. Plus, I put these little new pieces of information in my daily brain blog. And I've put on your table a sheet of paper where you can find my website address, and you can sign up to have the blog delivered to your email address every day. I do it during the week, 5 days a week. And you can get some of this little bit of information and then figure out if you want to study into it more. But here's a really interesting study. A common genetic variation accounted for almost up to a third of somebody's risk for developing or having identified one of these 5 specific types of brain function pieces. And it's so interesting that it often involves, and I hate to use the word defect or abnormality, it involves a variation in the way some of these neurotransmitters occur and how they're used. You know what a neurotransmitter is? Up and down means yes. Okay, it's a brain chemical that helps the brain do its functions. So with autism, they found that yes, a genetic component accounts for at least a third of it, and I'm guessing that that's going to go up. But the difference with the autistic brain often relates to low levels of both serotonin and vitamin D. And vitamin D3 is being looked at now as really critical to brain function, and that giving individuals some additional vitamin D has been shown to decrease the symptoms in many of these conditions. ADHD has low serotonin and low dopamine. Okay, dopamine is the feel better chemical. So they do what they need to do to try to get more dopamine so they feel better. Serotonin is the neurotransmitter that helps you sleep well, that helps you avoid being depressed. I mean, there's a whole list of functions that are impacted by these neurotransmitters. Bipolar disorders, it's another neurotransmitter imbalance, if you will. Depression, low serotonin, hello. And schizophrenia, dopamine dysregulation. So you're beginning to see that a lot of these conditions may have some genetic correlation. Now, we don't know if the genetic correlation causes the defect or the difference, or are we just recognizing there is a difference in individuals who have one of these or more diagnoses? Because correlation is not necessarily causation. You understand that? And sometimes we have found with further research that this caused that, it triggered it. But so far, we just know that there's a correlation here. So I find that pretty fascinating. Your brain is the very first body system to recognize a stressor. And it will recognize it in a nanosecond. And when it recognizes a stressor, it begins to activate the stress response in one incident that it perceives as stressful, can keep that stress response going for up to 72 hours. And longer if that stress keeps reoccurring, and or if the person keeps rehearsing the event in a broad way, play type of acting, telling everybody who will listen to them over and over and over and over and over again about this problem. You keep your own stress response going, and that's unhelpful to the brain and body. We'll talk about that. The goal is not to get stress out of your life, because the absence of stress is death. It is stressful just living. Every time I make a move with my body, I am stressing my body, because it means that the definition of stress is you've just asked your brain and body to do something different, and it's able to respond. And when your brain and body can no longer respond to requests to move, to eat, to breathe, whatever, then your history, you're dead. So the goal is not to get rid of stress. It's to understand the different types of stressors, prevent what you can, and manage what you can't get rid of. But you're always going to have some stress, and that's a good thing. Now, the good part of stress is it helps you respond to situations that are unusual, to keep yourself safe and healthy and well. The bad news is that if it goes on and on and on unmanaged, then you're going to start killing brain cells. That is not a good thing. Because I mentioned earlier, you have the neurons that you were born with, unless you've already killed some of them. Yes, we can replace some neurons, but not many. They do not multiply and divide like other cells, which is what's critical to teach young people. What you do that affects your brain will likely affect you for your entire life, because if you damage those neurons, you're not going to get them replaced. Which is one of the reasons that I tell people, if you smoke, stop. If you don't, never start. Because the components of cigarette smoke, nicotine, are damaging to the brain. And having said that, every time you inhale smoke, you get about 20% less oxygen to your brain than you would have if you were just breathing in regular air. And eventually, over time, that can damage and kill brain cells. It can certainly suppress immune system function, which is what helps to keep you healthy. Now, because every brain is different, stress is different for every brain. So one person's poison is another person's pleasure, so to speak. I mean, if it's really outright horrible, we've got a major earthquake, that's one thing. But it is different for every brain. And we have new research about how different it is for the female brain versus the male brain. And we'll talk about that. The brain automatically implements a stress response, as I already mentioned, when it's confronted with a stressor. But our reactions to the stress response are unique, and we usually learn those in our family of origin in childhood. That's why some family systems don't seem to manage stress well at all, and others seem to be stress hardy, stress resistant. Same kind of stressors, but it's how they're managed. It partly relates to expectations of yourself as well as those of others. We can't really do much about the expectations of others except decide how we're going to manage them. You can do everything about the expectations you have for yourself because you created them. The stressors interact with the brain in a two-part equation. 20% of any negativity in your brain and body is due to the stressor. 80% is due to your perception of the stressor, and what does that mean? So, there's some percentage of the effect to your brain and body of a stressor that you can't do a lot about. But that's 1/5 of the potential outcome. You can do everything about the 80%. So I'm really clear when I am faced with a stressor. I have responsibility for most of how that's going to affect me because I can do everything about the 80%. Now, the individualized piece of stress. It's very different. Brains that perceive they don't match what's expected or don't fit into society's description of normal, this group under the bell curve, will experience a stress response. Period. Because they realize at some level they don't match. And a mismatch with expectations causes stress. At least two things will happen. First of all, the stress hormones are triggered. They're going to pour out adrenaline, cortisol, and norepinephrine. That's going to have a huge impact on the hormones in the brain and body and whether or not they stay in balance. I heard that, Anita. I didn't see it, but I heard it. And the second outcome is that the brain begins to downshift. So here's a cutaway of the brain pulled apart so you can see the three functional layers. And if you think of them as the first layer is your wrist, the second layer is your fist, the third layer is your other hand over top, and you move that right into your brain, that would be the functional layers of the brain. So in this first layer is where the stress responses are loaded. Fight, flight, tend, befriend, conserve, withdraw.
Is that what they mean, the reptilian brain?
Yes, absolutely. This is the reptilian brain because that's all reptiles have. This is the mammalian brain because mammals have a little bit more brain function than reptiles, thank heavens. Are we mammals? Mm-hmm. Duh. And the third layer is called the neocortex, or the new brain, meaning that it has far more complex brain functions than either of these first two layers. And this is where we can get some conscious thought. So you only have conscious thought if you're using this third layer. And going through life without much access to conscious thought is not pretty for yourself or for anybody else. So when the brain is under extreme stress or chronic stress, often because it perceives it doesn't match, then the brain starts to move down from this third layer into the second layer, and then clear down to the first layer if it feels like it needs to go into fight, flight, and befriend or conserve, withdraw. And when it's down in these layers, forget about cognitive function. Forget about saying, the behavior you just exhibited is really unacceptable in this classroom. They don't get it. That's a conscious thought type of thing. They're reactive because they're feeling under stress, and the brain energy and attention is going down in the brain. So any brain that doesn't match is going to likely have those two pieces operational. Hormonal imbalance, lots of changes, pouring out stress hormones, and a lack of easy access to that third conscious level layer of the brain down here in the reactive parts. And in that third layer is where our loaded brain functions like planning, choice, making decisions, willpower, morality, and so on and so forth. So it's critical that we learn how to manage stressors. So the sense of not meeting expectations can stress any brain. Some of you may have noticed that I always speak with my shoes off. That does not meet expectations. It no longer stresses me. It did initially. But I had learned that if I take my shoes off, I do a much better job for some reason. I don't care how comfortable my shoes are. If I have shoes on, I'm aware of that. You don't want me thinking about my feet. You want me thinking about what I'm telling you. So I kicked my shoes off at one point, and the host came up to me after and said, "You were up there without your shoes on." I go, "Good, you noticed that. You're visual." "Well, I don't think that's appropriate." I said, "I regret that. That's your brain's opinion. I have a different opinion. My feet are clean. I've changed my socks. I'm more comfortable." So initially I got some pushback, which is stressful. No longer bothers me at all, because I am so clear. It's fine not to meet expectations. Just artificial. You know, back in Hippocrates' time, hardly anybody owned shoes. It was more likely, what have you got on your feet? You know, we change as the eons go by. It's not right or wrong, it's just different. Okay, you got those two pieces? So here's the deal. Children can be really cruel to other children, and we believe that's learned. We believe it is learned in their family of origin, maybe for several generations back with cellular memory, because that child is different. And until we start teaching children early in life that every brain is different, and every brain is gifted, and every brain can contribute in some way or other, and to be inclusive, we're still going to have the problem of kids being really ugly to other kids. And we're still going to have the problem of adults being really ugly to other adults. You know, there's big hype right now in the sports world because a player told people he was gay. People had played with him for years, thought he was a wonderful player, and the minute they found out he was gay, they changed in the way they related to him. Go figure. So it's different. Epictetus, another wonderful Greek philosopher, and no, I didn't know him personally. Came back from Greece not too long ago and said, "Oh, I learned about Epictetus in Greece." And somebody said, "Well, did you meet him?" And I said, "No, I didn't." He said, "It's not so much what happens to you as what you think about what happens to you that makes the difference. Have you got it?" That's been turned into the 2080 rule. Read it with me. It's not so much what happens to you as what you think about what happens to you that makes the difference. And we need to start teaching our kids that very, very early. So here we go, the 2080 rule. 20% you may not be able to do too much about. You can do everything about the 80% because you control it based on your own perceptions and expectations. Have you got that? If that's the only thing you got out of the whole day today, you'd be light years ahead of most people on this planet. Now, stress management for females. It's critical for everybody because males are equally stressed with females in this society, just their types of stressors are different. But it's critical for females because current research shows that females have twice the risk for stress-related illnesses and conditions. We had no idea of the reason for that, but now we know. Well, we know a piece about it. So this is rather complex, but I put the wording up here for those of you who want it. So I'll tell you what the research wording is, and then I'll tell you what I think that means to me. In response to a stressor, corticotropin releasing factor, CRF, something that the brain and body put out when it recognizes that stressor, it's both a hormone and a neurotransmitter. You got a double whammy here. It acts as two things, a hormone and a neurotransmitter. Many things are just hormones and many substances are just neurotransmitters. Corticotropin releasing factor is both, which makes it very complex. It binds to receptors on cells in the locus coeruleus, an alarm center deep in the brain. All right, we've just talked about those three layers of the brain. So down here in this bottom layer, brainstem and cerebellum, there's a little clump of cells called the locus coeruleus, and it serves as our alarm center. Is this hurting me? What do I need to do to take care of myself? And when there's any type of stressor, this CRF goes right to that part of the brain to increase our reactivity, if you will, so we recognize the stressor. So what does that mean? It means that when the going gets tough in the female brain acts macho. The male brain doesn't. Isn't that interesting? So all the women who've complained about males being macho, stop it. Some of them are, and that's going to stress their immune system. But the female brain is the one that goes macho under a stressor. So here's a cell in the locus coeruleus. Are you familiar with the term receptor molecule? All right. On every cell are receptor molecules. I don't care what metaphor you use that will work for you. Think of it as a door into the cell. Think of it as a docking station for a little boat so it can unload its cargo. All a receptor cell is a way of getting into the cell and affecting the cell. Have I said it in a way that is clear? All right. So, when a female brain is stressed and the CRF is released, it's got to get in the cell. So it goes to find one of these portals, docking station doors, and it dumps its load of hormone and neurotransmitter inside that cell. All right, the female cell, 1, 2, 3, 4, 5, 6, it's got 7 receptor molecules in this drawing. And this is done with rat brain studies. The rat brain is very much like the human brain. Makes a really good study creature. Some of you might not like to know that, but your brain is very like a rat brain. Or a rat brain is something like your brain, one of the two. So as this CRF goes in, all of these receptor molecule doors are open. So it takes the full hit of whatever is being sent to it. The male brain is different. We already knew that. But in this particular, it's very different. So do you see these little green things here? They're called arrestins. Think of them as, I don't know, Marine Corps helpers. You notice that in the female brain, there were some arrestins in there, but they're just sort of sitting in the middle and they're not doing diddly squat. just sitting there. In the male brain, these little arrestants are pulling in these docking stations, locking the door, whatever metaphor you're using. So there's only 1, 2, 3, 4 left. One's clearly in, one's almost in, and the third one is being pulled in, and we don't know exactly how many it would pull in. But if you're pulling in or locking the doors, so CRF can't even get in, you're going to have a whole big difference in the stress reactivity of that cell. Now, have I said that in a way that makes sense? Good. All right. This is unique to the male brain. It means female brain and male brain subjected to the same type of stressors. He's just not going to take it in. Women, have you ever had a male in your life during a stressful period of time say, "It's not that bad, just get over it"?
I'm married to him.
Well, maybe you want to teach him something about the brain, because it will not be as impactful to his brain. What are we learning, for example, about post-traumatic stress disorder and the differences? Well, we got people coming back from Iraq, Iran, Pakistan, and we had it happening in Vietnam, but there weren't as many women in the military. So this man comes back with post-traumatic stress disorder. That means he was under a lot of stress because his brain doesn't even take it in like a female brain does. And now we've got women coming back with post-traumatic stress disorder that took everything in. And in a year, if he works at it, he can recover most of the time. And we're working with women 10 years ago, they came back and they're still can't get past the stress response. So it's very different. I don't know whose idea it was to put women in combat, but I have to be really careful about where I say that. Because National Organization of Women believes that anything a male brain can do, I can do better. That does not square with research. We are equally valuable and equally competent. We are different. And we're going to be experiencing some of the consequences for not understanding that. So here, you can go to my website and get the article, read it yourself. It's not horribly technical, you can do that. So here's the female brain with 7 docking stations, 7 receptor molecules. Here's the male with 4 and maybe only 3. Huge difference in the way the brains will respond to stressors. Which means that the female brain is more sensitive to stress because it takes in more of the CRF, period. So men and women could really help each other with this. There's a situation that's happened in the family and she's just going up to the moon about it, and he's going, well, it's not wonderful, but it's not that bad, get over it. Well, that's going to be an additional stressor for her. So you guys are making it worse. So you can say something like, I realize that your brain handles stress differently from mine. I don't think this is any particular big deal because of this and this and this, and we can do this and this and this and help resolve it. And if a female brain understands that, that perspective is going to help her tamp down a little bit her stress response. She's still going to experience it more deeply. And the reason, the lack of receptor internalization, that just means the lack of those little green men locking the doors or pulling in the docking station, translates into an impaired ability to cope with high levels of CRF, and we clearly see that in depression and PTSD. So if you have any children that you know, male and female, who are experiencing any of those 5 conditions, for example, we talked about, it's going to be harder on the female brain than it is on the male brain. So take care of your brain first. The more you understand about brain function, the more you're going to be able to deal with things, because you'll have some sense of what's going on in the brain and what it is you can do to be helpful.